Hi everyone, my name is Dr. Jessica Pelletier and I'm an emergency physician, and I'll be talking with you today about public health approaches looking from a global health lens. So who am I and why am I here talking to you? I currently serve as an assistant program director at the University of Missouri in Columbia, and I'm also the African medical coordinator for Techies Without Borders. And we're a global nonprofit that delivers free, high-quality, continuing medical education in low-resource settings. My background is in education. I have a master's degree in health professions education, and a lot of my teaching and research work is focused on global emergency medicine. I help run our social determinants of health curriculum at Mizzou, and I've given keynote speeches on social determinants of health in the past. So public health is a topic that I'm really passionate about. My goals for you today are that by the end of the session, you'll be able to describe the three key strategies that support public health: health promotion, health protection, and disease prevention. So let's go through some of these strategies that promote public health. I want you to realize that there's a lot of overlap between these three domains, and sometimes public health activities don't neatly fall into one of the three categories. But I do want to go over the definitions for each of them before we dive into each category individually. Let's start with health promotion. So this is encouragement of activities that facilitate encouragement of activities that facilitate healthy living and well-being. Health protection refers to safeguarding the public health against external threats. Health protection refers to safeguarding the public's health against external threats. And finally, disease prevention refers to the assessment of health risks and development of interventions that halt disease progression. Let's start with health promotion. So some really obvious methods of health promotion that you're familiar with would be exercise guidelines or the food pyramid, things released by the government to get people to try and be as healthy as possible. But targeting social determinants of health is also key for health promotion. So for those who are not as familiar with social determinants of health, these are all the things outside of healthcare itself that impact our ability to be healthy. So realize that where we live and what we eat determines most of our health. We'll start with economic stability. So things like poverty, homelessness, and food security are all going to be things that influence our ability to be healthy. And public health approaches that can address this area would be, for example, stipends for healthy food. I know where I did residency, people were allowed to use SNAP benefits for the farmers market in our town, which is one method for encouraging healthy food intake. Elimination of food deserts. So a huge portion of even the US, which is a high-income country, has limited access to healthy food. So the closest place that a lot of people can get access to eating at all, their closest grocery store is the local gas station or fast food place. And so if you live in a food desert, it's really challenging for you to eat healthy and be healthy. And so eliminating food deserts by ensuring access to grocery stores, even in cities or in rural areas, is critical. And then housing security, so providing government housing and temporary housing for folks with homelessness can help reduce economic instability. Education access and quality is a second social determinant of health domain. And areas that fall under here would be things like high school graduation. So if you graduate from high school, you are much more likely to be healthy and to live longer than someone who did not. Higher education, so people who go to college are more likely to make more money and therefore be able to eat healthier and live longer than their peers who do not. And then folks who are non-English language proficient are more likely to struggle with getting access to healthcare and stay healthy because it's hard to navigate the system. So a few things that can address this social determinant of health category would be standardization of education and ensuring that there is a good, solid health education component in public schools. Availability of higher education, so ensuring that there are scholarships available to allow folks from lower socioeconomic status families or who come from disadvantaged backgrounds to have the same access to higher education as those who might be raised in a wealthier setting. And then making English language courses available for those who are not English language proficient can really help them be able to navigate our system. Another thing that dovetails here, so ensuring that there are interpreters available in the ED so we can provide equal care, because language and literacy contribute to poor health outcomes, meaning if someone doesn't understand what you're saying when you take care of them, they're not going to be able to follow your discharge instructions or know when to return. The third domain of social determinants of health would be healthcare access and quality. So having access to health services, so urgent care, primary care, and then being health literate, meaning knowing when you should seek care, are all critical aspects of staying and being well. And so universal healthcare systems, as we've seen in a lot of other developed countries, can help address access to health services. EMTALA is sort of our solution here in the US, where we have a third-party run healthcare system where there's kind of a capitalist mindset to things. So having an EMTALA law like we do allows everyone to get equal access to care as best as possible. It's not equal, but it's better than nothing. Improving the ratios of physicians to patients is an important aspect of healthcare access and quality. So meaning more doctors for a given population, particularly primary care doctors, can help reduce worsening disease outcomes in the long term. And then better education of the public about health and well-being. So this comes back to primary education, teaching folks in school how to actually be healthy, but then disseminating good public education about how to stay healthy once they're an adult and they're outside of the educational system. The next category of social determinants of health is the neighborhood and built environment. We already touched on food deserts earlier, but crime and violence is another huge aspect of health outcomes that contributes to things. So thinking about if you live in a neighborhood where there's a lot of gunshot wounds and stabbings, you're not going to go outside as often to exercise and be exposed to trees and things that make people feel happy because you're afraid. And then also, you're going to have higher levels of sympathetic drive just at baseline, which can contribute to more inflammation and chronic disease, things like cancer and heart disease. And obviously there's the mental health component of feeling unsafe where you live. So working to reduce crime and violence by having non-corrupt law enforcement systems and then cracking down on high crime areas is critical for people's health in general. And then environmental conditions. So ensuring that there's regulation of public housing and for landlords to make people safe. A few ways to think about this, reducing lead in the environment, reducing things like radiation exposure in places that have had environmental waste contamination in the past, making sure those areas are cleaned up before building new homes on them. And then quality of housing is another critical portion here. I know we've all seen kids with asthma who live in really dusty and old environments, places that have mold and things like that. And so, having laws that regulate where people live and making the environment safer can improve health. Social and community context is the last domain for social determinants of health, and a lot of studies have shown that civic participation, meaning being actively engaged with your community, helps reduce poor health outcomes and encourage longer life expectancies and things like that. People who suffer from discrimination, whether that's racial bias or if it is, bias against having a disability or being LGBTQIA or anything like that, experiencing bias and discrimination can lead people to have more chronic disease. And so better education of the public about differences between people and how we can find common ground is critical for improving the general health of the public. Incarceration can contribute to worse health outcomes, so people don't do as well from a mental health perspective, obviously, if they're spending time in jail. And so the other challenge is that when people get out of jail, if they're not able to find jobs, then that's going to lead to more mental health issues, substance use problems, things like that. And so finding ways to get jobs for people and provide them with job training after they've been in the law system can really help them to do better once they emerge. And finally, social cohesion. So I think, the example here would be in a town like where I live now, there's public events all the time to get people to bond and spend time together. And the more people do that, the more they can find common ground and get along, and the better and healthier people feel. A real-life example of health promotion would be something called JAMA Youth Organization, which is based out of the Gambia, a low-resource setting. So JAMA Youth Organization works to improve public health in the Gambia, which is the smallest country in Africa. You can see on the map that it's surrounded by Senegal on 3 sides and the Atlantic Ocean on the west side. Now, it's a low-income country, and they're still working to build a lot of their public infrastructure, meaning they don't have things like a current standardized collection system for garbage or recycling, and so people often just make piles of trash and have to resort to burning them. And this obviously contributes to environmental contamination and puts folks at risk for infectious disease. Another big issue facing the Gambia is lack of availability of good jobs for young people. The job market is pretty tough. And so JAMA Youth Organization provides young people with employment opportunities and works to clean up public spaces. And there's a great podcast that you can access at the QR code where my friend Sarah Balde, one of my good friends, is actually interviewed about the work that they're doing with JAMA Youth Organization. Another real-life example of health promotion activities would be food safety inspection, so ensuring healthy food for everyone that's safe and not contaminated. My friend Sarah, again, is actually the third person from the left in this picture, and he's working to make food safety standards the norm in the Gambia. All right, we've talked about health promotion, so let's move on at this point to health protection. One of the most obvious examples of a health protection strategy would be vaccination campaigns. So this CDC flyer is a familiar example, and I'm sure many of you have seen billboards on the highway encouraging people to get vaccinated against COVID and flu. We're kind of living in a modern era of misinformation and disinformation, which gets disseminated via the internet and social media. And because of that, there are a lot of folks suspicious of vaccinations. And so we are struggling with a measles outbreak now. And so more than ever, educating the public about how to prevent disease is so critical. Another example of health protection would be mandatory isolation. So I know a lot of us are familiar with the COVID lockdowns. Another example of isolation to prevent others from getting sick would be in a situation where we have a dog who's unvaccinated against rabies. We isolate them for 10 days after they bite someone to make sure that they are not exhibiting concerning symptoms, since we don't want someone else to get bitten and get sick. Another example would be mandatory home isolation for someone who just traveled to an Ebola epidemic area to ensure that they don't expose others. This kind of brings us to one example of a triage algorithm for Ebola that's being used right now in Uganda for their Ebola outbreak. So having algorithms that recognize potentially infected persons and getting them isolated from other patients and healthcare workers is critical for health protection of the public. I don't want you to read this. I just want you to realize that this is a good example of health protection. And then this is another thing I don't want you to read, but I just want you to see an example of a mandatory reporting form that helps screen folks right now who are presenting to healthcare in Uganda to ensure that Ebola virus disease cases are caught early. So again, this is a health protection strategy. Other methods of health protection that I know we're all familiar with, things like antibiotic stewardship. So making sure that we are not overutilizing antibiotics on our animal food supply or overusing antibiotics in the hospital setting on our patients, since antibiotic resistance is going to contribute to more disease burden for the public in the long term. Decolonization protocols, so people who are colonized with MRSA, ideally getting them things like mupirocin ointment for the inside of the nose, and there's plenty of other decolonization strategies for other bugs, but I think that's the most familiar one. Disease surveillance, so things like the public health, health department in a given city tracking cases of gonorrhea, chlamydia, syphilis, other reportable diseases would be an example of disease surveillance. Right now, a super relevant one would be measles cases. Hand hygiene campaigns, also critical for health protection. And then isolation precautions, so ranging from contact precautions up to airborne precautions. Those are going to help protect healthcare workers and other patients from getting sick. Another example would be environmental decontamination. I think a good one to think about. So in North St. Louis, where I used to work close to. They had an issue back in the 60s and 70s with nuclear waste contamination of the environment there, and unfortunately they didn't do appropriate cleanup before building houses in that area. And as a result, there's now very high cancer rates among folks in North St. Louis, which is a super shame. And so continuing to work to clean up the environment to ensure a reduction of disease is a health protection strategy. Let's move on to disease prevention. So cancer screening is probably one of the most common examples of how we protect people from getting disease and prevent it, and then educating the public. So this is an example public health message that aims to improve the literacy of the common average person about cancer prevention. Post-exposure prophylaxis is another example of disease prevention. So we are probably very familiar with giving things like ceftriaxone and doxycycline for folks with high-risk sexual behavior when they present to the emergency department. But things like HIV post-exposure prophylaxis or even antibiotic prophylaxis for someone with a close contact to a patient with Neisseria meningitis would be other ways that we help prevent disease. I do want to touch on education here because we've gone over the three major domains of public health strategies, and education is so critical to all three domains of public health, and it's also my area of expertise, so we'll dive a little bit into some interesting examples. So one real-life example of education dovetailing with public health is a group called Samaritan based out of Kampala, Uganda. And this organization was founded by an American pulmonologist who was originally from Uganda and wanted to give back to his home country through teaching. This image features my friend Bethel, who teaches at the only American Heart Association approved educational facility in all of Uganda. And she's a US-based paramedic and basically trained a team of nurses that have gone on to train hundreds of healthcare workers in Uganda on basic life support, advanced cardiovascular life support, and pediatric advanced life support that's sort of modified to the local context and keeps their resource limitations and guidelines in mind. So training healthcare workers is essential for ensuring a standardized level of care across the healthcare system and sort of optimizing health outcomes for the public. If you're interested, you can learn more at the QR code about what Moses and Bethel are doing to promote a standardized level of education for healthcare workers. Another example of the overlap between public health and education would be something like the Emergency Medicine Interest Group at Mbarara University School of Science and Technology. There are only 2 emergency medicine residencies in Uganda. One is located in Kampala and one in Mbarara. And emergency medicine is still a really new field in many parts of Africa, but it's up and coming in Uganda now. One of my mentees, Kakande Reagan, helped develop the EMIG to address the gap in medical student knowledge about emergency medicine as a specialty and sort of addressing emergency care in general. And the work he's done ensures that future physicians, whether they end up pursuing emergency medicine or not, have a basic level of understanding regarding basic life support skills, how to approach trauma patients, and things like that, so that the next generation of doctors can maximize health outcomes for their patients. There's a pretty cool SAEM Pulse article about the work that Reagan's done at the QR code. Finally, I want to touch on the work that I've done with Techies Without Borders, since there's a critical overlap between education and public health here. So in many low and middle income countries, electricity and internet are difficult to access, which really makes it hard for healthcare workers to look up information both on and off shift. A lot of them work in hospital systems that don't have the funding to provide access to clinical decision support tools like UpToDate. And so looking things up can be really challenging. So what we do at Techies Without Borders is we use technology solutions to address these gaps. Specifically, we use these miniature computers that project an intranet signal, sort of like a Wi-Fi network, within a hospital. And that connects to a custom phone app so that people can download PDFs and podcast files on medical topics of their choice to their phones without needing internet or electricity. It almost works like a digital library. And we also have a USB device for smaller clinics. When someone is connected to internet, they download the latest content from a cloud-based server, and all that content is emergency medicine focused. We're constantly taking feedback from users to shape the content that's on there so that we're meeting their needs. And even at sites where we don't offer the USB or the miniature computer, we offer monthly virtual journal clubs and free cases, as well as multiple choice questions to foster learning that we share via email and WhatsApp. I think one of the most poignant examples of how the educational work we do overlaps with public health is our partnership with Seed Global Health in Uganda. Seed essentially plants educators in a given area, hence the name Seed, to help develop emergency care systems. And right now they do a virtual webinar every 2 weeks called ECHO that's disseminated to somewhere around 700 healthcare workers across Uganda. And they basically go over the emergency approach to a wide variety of conditions that's contextualized to the local needs and guidelines of Uganda. Recent example would be, since they're going through an Ebola outbreak, they've been doing weekly sessions on the approach to triaging and protecting healthcare workers. They've been going through the emergency care of an Ebola patient, how you prevent infection in the public setting. And so these are critical public health media strategies to get everyone on the same page to prevent spread of an epidemic. It's really difficult for some people to connect to Zoom, so basically at Techies we write a summary of the key educational points from the ECHO session, and this gets disseminated to hundreds of people. And this knowledge dissemination sort of helps create an equal playing field for healthcare workers across a wide variety of settings with a huge variation in resources. So to kind of summarize here, helping healthcare workers in limited resource settings stay up to date is critical for improving the health of populations. If everyone is on the same page with the most recent knowledge, the things that they need to know to take care of their patients, then that's going to help ensure better public health outcomes. So some take-home points here. Public health approaches include health promotion, health protection, and disease prevention, and there's a lot of overlap between these three categories or domains, and education is essential to all three of these being successful. These are my references. There's a long list of references about the social determinants of health context, or rather the content at the Google Docs link. And then if you have any questions, you can feel free to contact me. I appreciate your time, and I hope you're a little more excited about finding ways to get involved in public health. Just consider, even if it's something small like volunteering at a vaccination campaign or signing a petition to help protect public health measures like the CDC or USAID, things like that. Getting involved in whatever way you can. Your voice matters as a physician, and so I just want to put it out there that our important work as emergency physicians doesn't just have to do with the patient care we do on shift. It has to do with what we do outside of shift to help promote the health of the public, and you have the ability to make a huge impact. Thanks for your time, and I hope you learned something during this session.